Welcome, everyone. Thank you so much for joining us today. I'm really excited to be here. My name is Jackie Garlock. I'm here with the Community Technical Assistance Center, and I'm very excited to welcome everyone to today's webinar, Navigating Professional Boundaries in Clinical Care. Before we get started, I just want to take a moment to orient everyone so that we know how best to participate in today's event. So you'll notice that on joining the webinar, you've been placed on mute. This just helps us to avoid any background noise. You can certainly activate closed captions for the presentation, and you can do this by clicking the button on the toolbar that says live transcript and then selecting show subtitles. If you come across any technical issues today, please chat into our host of the CTAC admin account. It's my colleague Leslie, and she'll be able to help you with anything that you need. Throughout the presentation today, we'll be using the chat box feature. You can access that with the little dialog bubble in your toolbar. You also can use this to submit any questions that you have throughout. We're going to have a Q&A section at the end. So at any point, if you have any questions, please use the chat to submit those throughout. We are offering 1.5 continuing education credits for eligible counselors and social workers attending today's presentation. So if you're eligible to receive CE credit, you'll get an email in 2 to 3 days, and that will provide you all the information you need to get those credits. We're also going to be asking everyone to fill out a brief survey at the end of this webinar. So we'll really appreciate your feedback. Please let us know any suggestions for future topics you'd like us to cover. And also the recording and presentation slides for this presentation will be posted on our website, ctacny.org, within the next 2 to 3 business days. So that sort of business out of the way, I'm very excited to be presenting today alongside my colleague, Nicole Lee. Nicole, would you like to introduce yourself?
Happily. Good morning, folks. I'm Nicole Lee. I'm a clinical social worker and alum of NYU, proudly. I've done a bunch of things in my career so far, including overseeing outpatient programs, residential programs, and I currently am helping oversee the administration of 988, the National Suicide Crisis Lifeline. And I also have my private practice going. So I'm very close to the direct care as well as kind of meso and macro systems. So I'm really, really excited to be here with you all this morning. Back to you, Jackie.
Amazing. And for those of you who didn't hear when I signed on, my name is Jackie Garlock. I'm also a licensed clinical social worker. I am the Assistant Director of Training Development here at CTAC. And a lot of my experience has been working with youth and children and families. And I'm really excited to be talking about professional boundaries, and it's a passion area of mine to talk about today. So I'm very excited to be doing so. So we already sort of covered a little bit of this. These are just, again, our continuing education requirements. Again, we're offering 1.5 CE units for eligible social workers and counselors. You need to be signed in with your own Zoom link and on a computer, and then we'll be emailing you about how to access those CEs in 2 to 3 business days. So our agenda for today, we're going to talk a little bit about what we mean by boundaries, and then talk about sort of why they are important, why we're here and talking about them anyway. And then we're going to talk about what it means to sort of construct and assess our own boundaries. And then we're going to get into how to communicate those boundaries to the folks that we work with. And then what does monitoring look like? So that's sort of our agenda for today. We have our learning objectives. So very similar, we're going to define and recognize their importance, look at how we construct and assert them. We're going to talk about how we assess our own boundaries. We're also going to talk about the relationship between boundaries and compassion fatigue and self-care. And then again, learn those strategies for communicating boundaries to clients, and we're going to have some chances to apply those in a case study. Okay.
All right. So to start off, we're going to define boundaries. If y'all have seen the chat quite lively, if you all would chat in your definition of boundaries. When you hear the word boundaries, what comes to mind? How have you all spoken about it in your work thus far? Okay, I see a standard you set from Selena. I hope I'm saying your name correctly. Setting limits from Doris, thank you. Limits, great. Setting expectations from Amber. Awareness of limits, so some themes around limits. Making people feel comfortable. Oh, wow, you guys are just having them flood in. This is fantastic. Limits to keep everyone safe. I saw safety. We're going to touch on that. Understanding your limits. I love that framing of it. Being respectful of your time. Great, y'all. Okay, fantastic. So I'm going to move to the next slide because you are already kicking us off with this framework really perfectly. So what we're going to define as boundaries in this space is a lot of what y'all had said, which is the idea that boundaries are the limits that allow for a safe connection based on the client's needs. And I want to also emphasize that in this presentation, we're using the word client to describe the individual or individuals that we're serving. So you might serve families, you might serve one individual, teenager and, their parents as well. You might serve a young adult. We're going to use client to kind of represent whatever constellation of individuals are that you're serving. So boundaries are like a property line or the defining lines of a shape. They show where one thing ends and another begins. And they help each person figure out where our person ends and the other begins. Where do we end as the professional, as the provider, and where does the client or the clients that we're working with begin in terms of our roles and expectations and everything you all put in the chat, which is fantastic. Want to also just emphasize that there's the theoretical, there's the ideas of boundaries, but then there's also physical boundaries. How does touch come into boundaries? There's the relational boundary of, personal versus professional. There's hierarchy boundaries, supervisor versus supervisee, not versus necessarily, but and then just professional roles and expectations as a framework for boundaries as well. So the other, just to extrapolate on that a little further, we wanted to emphasize that boundaries are the line between what is acceptable and unacceptable, what is safe and unsafe. We saw safety mentioned in the chat. That's huge. What's helpful and unhelpful in terms of what the client's goals and needs are for the work that's ahead of you. And finally, and my box is being, there we go. What falls within an individual's role and responsibilities within a relationship and what does not. And so it's really defining and constructing and understanding where does your expectation, your role start and stop when serving clients in this work. And we want to also encourage y'all keep chatting in, asking questions throughout if you have other things to add in. This is a interactive, collaborative presentation, so don't hold back. All right, the importance of boundaries. Why are we here to talk about boundaries? So we came up with these kind of overarching themes around the importance of boundaries. We were thinking through how do they show up and how do they exist and what kind of influence do they have on the work, on the work that you all are doing and that we do as well. So they really do help guide clinical decision making, help us understand what is going to be helpful, what's going to be effective in the work around the client's goals and the client's needs and the work that you're doing and what your responsibilities are. They really ensure that services are helpful, safe, and appropriate. Again, kind of reinforcing that clinical decision making. What's going to be what intervention might you use to make sure that you're assisting and directing the work in the direction the client is looking to go. It also provides a model. Boundaries provide a model for clients in that, them being able to see our professional roles be clearly defined and communicated. It creates a model for how they can also emulate that in their own relationships. Sometimes in different structures and different family structures or relational structures, there isn't a clear way of how to set what is where an individual starts and the other person stops. And so if we're able to do that effectively, healthfully, then that helps have a model help set up a model for the clients that we're serving. It also can prevent splitting on teams. So the idea that a client may go to one person for one professional for one element of support or service, but then another person for a different kind of service. If we're really clear about what the boundaries are and what the responsibilities are of every professional that's working with a client, it will help unify the support that's being offered and make really clear expectations of who and what services are available for the client's goals and what they're working towards. Also can avoid re-traumatization. We want to make sure that we're not contributing to any harm, that are reliving or recreating any kind of harmful relational dynamics that a client may have experienced in other relationships, either from trauma in childhood or domestic violence or intimate partner violence comes to mind, and just lack of clarity and boundaries and expectations. So being able to be clear and upfront about what professional boundaries are in your role in serving that client will avoid re-traumatization. And we're going to talk about this quite a bit further on in the conversation, but the idea that boundaries and being clear about boundaries and how we assert them and construct them will actually help providers help us sustain in this work and prevent compassion fatigue and burnout. So knowing where you stop and the client starts, knowing where your role begins and ends, will help ideally create that sort of sustainability in the practice and protect you as a worker in this caring field. And we've said this, we saw this in the chat, but clear expectations, clarity in role, clarity in responsibilities, and setting up everyone for success of knowing what are the potential goals you can work on together, what may be out of your scope of practice and what may be out of your scope of responsibility, depending on the role and the setting that you are working within, and just help everyone, have clarity, because clarity is it's helpful. All right, and I want to pay attention to the chat. I know, Jackie, you've got eyes on that too, but if there's any questions or thoughts coming in there, I don't think we have
None
any.
yet, but yeah, definitely would like to hear any thoughts that folks have about what we're discussing. Any questions that are coming up, please throw those into the chat. We'd really appreciate your feedback
Great.
and thoughts.
All right, so Jackie found this quote, which I think just really articulates this sort of framework beautifully. Without boundaries, you will act, sleep, work, groan, feel used, and fulfill basic responsibilities rather than make choices to live and love fully, to work hard and nobly, to fulfill your purpose and to contribute passionately to your world. So, the idea that boundaries will actually set you up for success and set the clients up for success, and knowing where you can support their goals and in your role help them meet their needs, and where you're not able to, and maybe you redirect or connect them to someone else who can support in that way. So kind of knowing where you start and stop. And so I'm seeing Nadine mention, please explain re-traumatization a little bit more. Nadine, if you want to raise your hand and ask anything further about that too, feel free. You can raise your hand and go off mute. I guess I'd be curious kind of your question specifically, but the idea being we don't want to perpetuate or reenact any patterns of unhealthy relationship dynamics. And by having and modeling clear boundaries, you're setting what your boundaries are up around your role, and therefore having clear expectations about how you can show up for this client or what your role can offer in terms of meeting their goals. So let me know if that answers that question there. And Patricia, exactly, you're not your client mother or father. You're not, it's different to be a family member and a support, to be a provider and a support. They could both be supportive relationships, but they have very different boundaries.
And I think that sometimes also be like that expectation. A lot of folks that we work with have not had great models for what healthy boundaries are, where they've had their boundaries violated. They haven't really, ever felt like they've had that sort of like respect of boundaries. And so they may not have great boundaries themselves. And so it can be easy to sort of fall into those patterns where we are drawn into those sort of reenactment of trauma. So, okay, I'll do this for you just one time, but it'll be our secret. And now you're keeping secrets. And that is often a hallmark of trauma for a lot of people, that they said, don't tell anybody. Or, you said one thing that this was expectation, and then you did another thing. And that is sort of, again, that sort of re-traumatization that people's actions and words didn't match. So there's all sorts of ways that when we're not intentional around our behavior in terms of boundaries, we can end up creating situations that are re-traumatizing for folks.
Spot on. Thank you, Jackie. All right. So where do these ideas of boundaries come from? So we wanted to set y'all up with a little bit of some context of, how does this idea of professional guidelines, professional boundaries come up? And depending on your setting, depending on your license, or your credentialing, your education, there's all these different bodies and institutions and entities that define what are professional guidelines, what are appropriate boundaries. And so wanting to name, we have codes of ethics. We just name, this is not exhaustive by any means. This is just kind of like, top of mind in connection to the work that Jackie and I have done. What were some of these bodies that came to mind for us? So thinking of codes of ethics from different professional bodies, so National Association of Social Workers, the APA, psychological and psychiatric associations. Thinking about licensing bodies, Office of the Professions, if you're a social worker in this space, or a LMHC, MFT on the West Coast, there's state bodies that have certain requirements to say what it is to become a licensed, practitioner. Then we have accrediting bodies for the actual clinics and the agencies and the hospitals that do this work. So to name a few, like the Joint Commission, OMH, DOHMH, those are acronyms: Office of Mental Health, Department of Health, Mental Health, and these kinds of overseeing bodies that make sure these places of practice are meeting certain requirements in terms of the quality and the service being provisioned, and that the practitioners are doing what they ought to be doing within the boundaries that are appropriate. But then you obviously have your employer or your agency's policies. If you're in an outpatient clinic, if you're in a school, if you're in an inpatient facility or a shelter, a transitional residence, different sorts of policies around hours of operation, or when clients can reach you, or how do you interact with clients that you're serving. And that's going to vary depending on where you work and what the policies are therein. And then wanting to also name just, the world we work within, thinking about how we have to reimburse often for these services, and how those bodies such as Medicaid, Medicare, and insurance companies also come into play to say, this is an appropriate amount of time for a session for this type of service, or this is what a crisis intervention looks like and can be reimbursed for. So just we're not going to go too much deeper into this, but wanting to frame that also, that we're talking theoretically about boundaries and how to define them and construct them and monitor them, but that they come from all these other entities, not just our individual selves. So there's so many layers and overlapping sort of influences that define what boundaries are. Loving seeing the introductions in the chat. So thanks for
Welcome everyone. I'm
Yeah.
loving people are coming from all over.
Yeah, representing. All right. So risks with unhealthy boundaries. So we wanted to provide these definitions, thinking about what are certain boundary behaviors and how they can, do the opposite of what clear boundaries support. So boundary avoidance is one term that we wanted to explore, which is when we're really not engaging in the behavior in question. So it's a boundary that you're not going to really you're not going to engage with. You're going to protect potentially with like physical touch. So maybe if you're working in an outpatient setting, I've worked in a few in my day. Maybe you're instructed by your agency that you do not touch your clients. You don't, hug them. You don't shake hands, depending on the space that you work within. And maybe in other settings that is not the rule, or not the boundary that's defined, but avoiding a boundary and not engaging in that behavior in question. A boundary extension is, you may have heard the term boundary crossing. In this frame, in this webinar, we're going to actually use the word extension, because if we think about that definition of boundaries being sort of a shape, a line that is kind of moving or is around a relationship, an extension may be a redefining or a renegotiation of a boundary. And it's a deviation from the strict definitions of one's professional role. So in my practice, I work with kids a lot. And so in outpatient clinics, and I've worked in settings that focus on survivors of domestic violence and intimate partner violence. And we were, by default, because of our training, advised not to necessarily initiate physical touch with any client, but children often, especially if you've developed a rapport, you have a good relationship, they may run up to you and give you a hug. And so weighing the kinds of impact or consequence that could happen if you said, you rejected that hug from that child, or you pushed that child away, not pushed, but did not engage in the hug, what would the implications be for that young person and that client's sort of idea of your relationship? So there may be extensions that are not violations, but a kind of a renegotiation of what does it need to be in this instance to meet the client's needs and what the goals are for the work that you're doing. And then a boundary violation is an actual transgression, crossing isn't exactly the word, but moving over a boundary that's been drawn that has significant potential harm or potential for harm or exploitation. So we wanted to name, sexual touch. That's like a black and white, not appropriate sort of transgression that would be considered a violation. Okay. It's a dense slide. I spoke a lot. If you have questions, chat them in.
I also see that we have someone who has their hand raised. So if folks want to unmute Anna, I think you have your hand raised.
Okay. And we'll keep it moving, but if you want to, unmute and interrupt, that's totally fine. We welcome the conversation.
Great.
All right. So to continue on risks of boundary violations, what to look out for. So these are not exhaustive, but things that we've seen in the research and we've experienced ourselves around, boundary extensions, boundary violations, and things to be aware of. So experiencing thinking or talking about clients when away from work. People in this field care about the work. We care about the work. So we're going to think about clients. We're going to, appropriately, observe HIPAA, but talk about clients with our supervisors or our coworkers. It's really, looking at the intensity, the acuity, the frequency at which this is occupying time outside of work hours. And so that's really a self-assessment for y'all to think about. Prioritizing a particular client over other clients, is there a bias showing up? Is there some kind of preference showing up about one client, and, exploring further why that is, which we're going to get to later. Sessions regularly running over or finishing early. You have a set time, you have a expectation for what sessions, the duration that they ought to take because of various institution bodies overseeing the work that you're doing. So being aware of why that might be, and looking at why they might run over and why they might finish early. Feeling responsible, guilty, or down when a client does not progress. So kind of taking on that movement, that progression personally, or even if it's a personal, responsibility, being aware of the impact that's having on how you're feeling and connected to the work. And then keeping secrets. So Jackie mentioned that earlier around re-traumatization. If we're keeping secrets either from the client or for the client or from your supervisor or your team, that could be a sign to look out for. That secrets, as my one of my mentors trained me around, secrets can breed symptoms, and so symptoms and secrets are not. It just could be a sign of a boundary extension or violation. Finding it difficult to hand a client over to other services or workers. So kind of the idea that maybe you recognize that your work has met its goal with the client. You've reached where you need to, what the extension of, to the extent that you can serve the work that you're doing, and that you're having a hard time maybe closing the case or referring to the next level of services that would be appropriate, or stepping down to a lower level of services. And then finally, a client telling you that only you understands them. So like that over-identification with you as the helper, as the provider, and helping the client see places and spaces outside of the therapeutic relationship or outside of the provider relationship that you're in that they can also identify with.
And I want to note, someone put in the chat that I think this was in reference to the prioritizing a particular client. Someone said, some clients are going to be higher need than other clients. They'll be in crisis. And that is a completely valid point, right? There are going to be times when you are going to spend more time with a particular client, or more time, maybe not even with them, but on their case, right? Making referrals, filling out different, types of paperwork for them, trying to get them the resources that they need, whatever, your role entails. These are things that can happen and also are not necessarily a boundary violation. And also thinking about, okay, even when this client's not in crisis, consistently, am I giving them more attention? Is it interfering with my ability to be present with other clients, or to give them the attention that they need and deserve? So again, these things may happen and they may not be signs of a full boundary violation, but it is something to look out for. And in terms of when we say risk, this is a risk thing, as opposed to like, this is not a definitive, if this happens, it means there's been a boundary violation.
Thanks, Jackie.
But
Yeah,
I think it's
really,
I appreciate you pointing out that it's a gray area, right? There's not always a black and white with these
yeah.
things.
And I appreciate Leah mentioning that, because I've been in positions where, I'm working with a client. They've disclosed a really important, like maybe even suicidality, right? And I'm not going to be able to end that session. I'm going to have to assess for risk. I'm going to have to then involve my supervisor. I'm going to have to potentially involve higher level of care. My next session may get canceled. I have to coordinate that effectively. So this is not exhaustive. This is not at all an if-then sort of list. It's more of things for you to be aware of as providers in this field and continue to assess around, which we're going to talk about more as we continue. So thank you for that note. All right, let's see where we're at next. Okay, so negative consequences. If boundary violations occur, what could happen unintentionally? So you may recreate dynamics that echo previous abusive relationships or other unhealthy dynamics, as we talked about with the idea of re-traumatization. You may act in ways that put the client's safety at risk. A lot of you talked about safety as a part of boundary definitions, and that's absolutely true. Making sure that your role, the client's expectations of how you can show up is really clear, so that if there are safety concerns, those are assessed and the boundaries are defined very clearly around that. It could accelerate your own compassion, fatigue, and burnout. Being able to turn off if you're not in a 24/7 on-call situation, which I've also worked within, or figuring out how do you sustain and manage within that sort of setting, figuring out how do you practice self-care, how do you take care of yourself. Boundaries can help maintain and sustain in this work. It can also do possible harm to the relationship with the client. It can kind of damper trust if your actions and your words do not match, or if your actions and the words of the expectations of the agency or the policy or the setting that you're working in don't match. Secrets come up about holding a certain detail that is aside from the work that you're doing or what your team may know, that can cause harm within the relationship. It can create unsafe environment for other clients or staff, and it can also you can also intervene with inappropriate or ineffective treatment. So making sure that you're, equipped and the work that you're providing, the services you're providing are within your scope of practice, that you have the training necessary, the supports necessary to do the work. If you don't have those things, it can obviously have a negative consequence on the work and the goals of the client. And now I will pass it over to Jackie.
Yeah, thank you so much, Nicole. So I think that, we're now going to get into, we know a little bit about what we mean by boundaries. We know now sort of why it's important that we have boundaries. And now we're going to get into sort of how we construct or identify our own boundaries within the confines of our professional role. Because there are different types of boundaries, right? We have boundaries in our personal lives as well. We have boundaries in a lot of different relationships. And so, but how do we think about them in the context of our role as a professional with the folks that we work with? So there's this model that I really like. It's called the zone of helpfulness. This idea that we want to fall within this central zone, this zone of helpfulness, and in terms of what is helpful to the folks that we are working with, to the client. So one of the things that we know is that, based on codes of ethics and just a lot of things that we learn in school, is that the purpose of our services is to serve the needs of the youth, children, families, the clients that we are serving. And so in terms of, we are in a helping profession. And so we want to be centering the needs of the folks that we're serving, of our clients, and support their needs. However, there are also times where we may unintentionally center our own needs over those of the client. And that's when we get into those under-involved or over-involved zones. And I want to be very clear, we talked about the relationship between boundaries and compassion, satisfaction, and self-care and wellness. Your needs are important. You cannot sustain in this work if your needs are not being met. And we want to make sure that those needs are met outside of the relationships with with our clients, that, so that we're not in the room with the client looking to get those needs met. So again, it's this sort of a continuum, and you can see that there's sort of overlap. There are areas where it's not always exactly the clearest. And so you can see the sort of over-involved zone and under-involved. And both of these are things that we want that can happen if we're not prioritizing the needs of the folks that we work with. So on the side of over-involved, this is often what we think about when we think about boundary violations. So this could be oversharing personal information, giving special treatment. So these are kinds of the things that we just looked at in the sort of risk factors. Enmeshment or codependency, savior mentality, thinking that you have to, being, again, over-involved, doing more than the confines of your role in order to meet your own needs, or for whatever reason that is not solely focused on the well-being of the client. And then sometimes we also have under-involved. So this can be avoiding conflict, not, wanting to bring something up with a client because you don't want to engage in the back and forth that might come. It could be neglecting your clients, right? And that doesn't have to be, like neglect neglect sounds very extreme, but sometimes it could be just not calling them back, or not calling them back in a timely manner. It could be not maybe always doing as much to support a referral that you would with a different client. And these are sort of that compassion fatigue, right? Maybe you're not, sometimes also this is an internal thing, not really empathizing or really having that same kind of compassion for our clients, and then also resenting them, right? So I gave you this referral, you didn't follow through with it, and now I feel resentful that I did all this work and you didn't follow through. As opposed to understanding that sometimes these things are a part of a person's trauma response. Our goal is to be there and be helpful, as opposed to feeling resentful. So these are all sort of a way of understanding where we want to be in that zone of helpfulness, that sort of behavior that is helpful. I see that there's another hand raised, Amanda. If you want to unmute, I'm wondering if you have any thoughts on this that you want to share.
I'm seeing in the chat, Kelly said, I don't think we can unmute.
Oh, okay.
That's good for us to know. Thank you so much.
No.
Amanda, if you want to chat in your thought, please do. And while we're doing that, we'll see if there's something we need to switch.
Yeah, I'm
Make
wondering
it so that y'all can chat in.
allow people to unmute.
And while Jackie and Leslie are looking at that, Danielle, I totally agree around supervision styles, zone of helpfulness, this framework, this kind of continuum can show up in how in your compassion and in your supervision work, and how you're overseeing folks doing direct services. So great flag there. All Alia. Will we also be talking about professional boundaries with coworkers? Oh, that's a great flag. We actually not so much in terms of maintaining professional boundaries with coworkers in the space. This is really focused on professional boundaries with the folks, the clients that we're serving. But I think that's a really interesting um, yeah, note for us to take back and think about. Is there a need there to
Yeah.
kind of think about a training on that end? Yeah.
Yeah. And I think that a lot of this can be applied to our relationships with our colleagues. We don't have exactly the same kind of relationship, but it is a relationship that there are bounds to. And so um, where do we end and where does our employer or our colleague begin? So there are definitely boundaries that folks set for themselves with relationship to their employer. So, sometimes it might be, I don't answer emails after a certain time of night, or I don't discuss certain things with colleagues. And there are reasons why. The reason these are different is because you are centering the needs that we center are different. Okay, it looks like we potentially allowed folks to unmute. I'm wondering if Amanda or Riwan, if either of you are able to unmute. I know that those are people that have their hands up right now.
Yeah, I'm unmuted. Can you hear me?
Yes,
Okay.
amazing.
So my name is Brejan.
Riwan, sorry about that.
It's okay. I had a question in regards to the neglect piece.
Mhm.
Um, I'm struggling with understanding how not calling back a client in non-emergency situations can be neglect. Like the work we do is heavy and time consuming, and sometimes a boundary of mine is not answering the phone outside of work hours
Sure.
or not returning a call, even though I see that you called me, but I have the plan of calling you back another day. So I'm wondering if you could elaborate
Yeah.
on the neglect piece.
Yeah, no, that's a great question and a great example. And I'm really glad you asked that because it sounds like you thought of a boundary. I don't answer outside of work hours, and I have specific times I've built into my calendar to return calls. I think that is like clear boundary that like maintains your own ability to sustain in the work and also creates a clear expectation with the client. The difference is then if I don't want to call back a client because I know that the person on the other end of the phone is going to give me grief, is going to be difficult to talk to, is going to make me feel bad, because maybe I don't like them or I don't enjoy working with them or, for whatever reason it is, or I'm feeling burned out by the content of, I should not burn out, like compassion should be based on the content, the trauma content that comes out. And so I start pushing them down my priority list, not because it's part of my boundary, but because I just feel like I can't deal with it. And that's, again, if you're not in a place to be able to attend to the client, that's one thing. And then you can seek out supervision for how can I manage this feeling so I can be present with the client. And if it's more like I am continuing to not engage with this client because of my own feelings, how is that creating that sort of expectation of services that we've agreed to with the client? So I think again, it seems like you're being very intentional about this in setting those boundaries and making sure that you have the space to engage, as opposed to doing something because like, I just don't want to deal with this, and especially when we do those things without intention. I've definitely had clients when I was like really early in the field. I remember working with one particular family that, it was really hard for me to engage with this parent. The parent it was not somebody that felt really great to be in the room with. They were very, a lot of the content that they were sharing about parenting was hard to listen to. And I didn't want to spend time with them. And so when it came to scheduling appointments or rescheduling appointments, I was definitely, and it's not even comfortable to think about. I think we don't always talk about our own sort of boundary issues, but again, I was very new to the field and I didn't want to deal with it. And that is different than having limits that you clearly state to the person in advance, saying like, I'm not going to I will return your calls within 48 hours or whatever your limit is or your boundary is. So yeah, I wonder if that's helpful, Brijan.
Very, very helpful. Thank you so much for clearing that up.
Of course. Amanda, I'm wondering if you're able to unmute if you had a question or a comment.
Oh, I saw the unmute. We'll keep it moving for now, but feel free to unmute.
Yeah. Yes. Also, we're going to talk a lot about what, a lot of these things do not have clear cut. There's reasons why there are ethics boards, right? For different, types of the work that we do, especially if you're like in a hospital. And it's because sometimes these things there's a lot of complexity there. And so seeking out consultation, seeking out supervisors, these are really important things to be able to negotiate and manage some of these. We also want to think about sort of the kinds of principles that underlie. Often we are given manuals by our organizations. And I think that we also want to say you always need to defer to your agency's protocols, right? So nothing that we're saying here should supersede what your agency has, had the rules they lay out. But often it's sometimes hard for us to understand what is behind those things. And so based on a lot of the research that we've done and our own experience, these are some of the things that we've identified that really underlie the principles that are underlying those decisions that you're making, because boundaries are really about those decisions you're making about your actions. So these, 6 things, and, feel free to chat in if you think that there are things that are missing here or that are not covered by these different categories. But so the first one is risk. So this is the one we most often talk about, which is that our actions minimize the potential of harm and enhance safety. And this is both in the short term and the long term for the folks that we're working with, for our clients, families, et cetera. The second one is accountability, so that there is transparency around what we're doing, that we're appropriately documenting what we're doing, and that there's appropriate oversight. So, people are putting in the chat about the importance of supervision and consultation. That is exactly what we're talking about here, that, there is accountability for what we are doing. Intention. So this is sometimes really hard to parse out. A lot of us are really good at convincing ourselves that what we're doing is for the best interest of of the client, when sometimes it really isn't about that. So really that the intention is that this is serving the best interest of the client, and it's based on credible evidence that action is likely to do so. So I'm choosing this intervention because there is evidence that this is the intervention is going to best serve the client, not because I just went to a training on this intervention and I'm excited, I want to try it out. So power, the provider's actions minimize the possibility of coercion or exploitation, ensure the relationship is non-transactional, so that there isn't this idea that there's a transactional nature, and then also promotes the client's own autonomy and empowerment. That's the sort of doing for versus doing with that we often talk about. Role, our actions fall within the scope of our role, of the treatment goals, and the limits of our expertise. Is this something that I have the ability to do? And is this something that I am the right person for? And then also context. So this is sometimes called like cultural factors, but I think it's more than just, cultural competency or humility, as we often talk about it, though that is certainly a part of it. Again, sometimes that's, am I the right person for this from a cultural perspective, right? But it's also, am I taking into account this client's individual circumstances, abilities, culture, the practice setting, et cetera. So these are the things that we think, and so again, I'd love to hear in the chat if there's things that folks feel like are not represented here, or other, things that they'd like to, discuss. I think I just mentioned how we often get this sort of list of do's and do nots. If you go onto a lot of different, websites about boundaries and ethics, they often have this list of like common boundaries. And again, it's useful to have these things where there are sort of black and white things. And again, maybe your agency provides you with a list of these. And again, we're not trying to undercut any of those, but I think it's helpful to understand where they come from. So it's not just that we don't want to accept gifts or favors for the fun of it. There's a reason behind it. And that's that we want there to be non-transactional relationships. They want there to be ensure that there isn't a power differential, that we're not exacerbating. There is going to be a power differential inherent in all of the relationships that we have as service providers. That's because of formal decision-making power, different amounts of information we have, information differentials, the professionalization of our helper role. And so, but what are we doing to minimize those power differentials within our relationships? And so not accepting or giving gifts and favors is a really big part of that. We often are told to not have dual relationships. We're not going to socialize outside work. The reason, again, is because of the transparency of our role, right? What are we doing to create clarity and consistency to ensure that there's clear this is my role. This is where, as we talked about, where I end and you begin. Self-disclosure. This is again about intention. Is my intention because I want to talk about myself or because I think that disclosing this thing will actually add to this person's ability to reach their goals? I'm, giving out your personal cell phone number, right? How does this impact, risk or power? So I think a lot of these, it's just about keeping in mind what is the reason why these common boundaries exist. And I see Doris in the chat. I think this is a great question, Doris. What if the client is offering something like a snack or dish that they made because of culturally for them, it's their way of connecting and showing pride in their culture? I love this question. When I first started in the field, I was doing in-home therapy with folks, with families. And one of my coworkers told me that the thing you need to do to be a good therapist is be able to eat and be willing to take your shoes off, right? And it was a great oversimplification, but this idea of what is your intention? Is your intention to engage with the family, to create that sense of trust, to build the relationship, to, in a lot of cultures, and I would say this cuts across a lot of cultures, engaging over food, over a dish is an incredibly important part of letting someone into your life. And so if you are letting this professional into your life, how does providing them food figure into that? So what is your intention by that? Or is it going to create, if you're coming to family dinner 3 times a week, what does that mean in terms of your role? And how is that going to create risk of harm or power imbalances, et cetera? So I think that that's a really important thing. So thank you so much, Doris, for mentioning that.
I want to also just jump in there, Jackie, with an idea about that. I've in situations similar, Doris, there's been clients that bring like cookies for the holidays. And if depending on the site you work at, depending on your setting, if there's a way to accept because of the impact that will have on the client, but then make sure that it's a distribution, like that's something we would do at a clinic I worked at, where it would be, okay, I'm going to share with the whole team here at the clinic. It's not just me, a personal gift I'm taking home. It's going to stay here in this professional setting. It's going to be shared with other providers that work here. But it's something to definitely talk about with your supervisor, with your team. What's a way to accept that appropriately, depending on your role, your responsibilities, and then the impact and the intention behind accepting or refusing a gift that's offered.
Just in the interest of time, I'm going to go on to the next slide. So there are a lot of things that can get in the way. We've sort of touched on this. I think one is that when we are, is dysregulation, our own dysregulation, and unintentionally, it often is unintentional, centering our own needs over those of the client, and again, we're talking about client as anyone that you serve. It can be youth, child, family, young adult. So this idea that we may prioritize our own needs unintentionally over those of the folks that we are serving. This can be exacerbated by compassion fatigue or burnout. It makes us those things can make it harder for us to be regulated. And this is what can make it hard for us to maintain those appropriate boundaries. So when you're feeling activated, so it brings up something in you because of your own past, overwhelmed, hurt, offended, or disrespected, helpless or frightened, insecure, if I'm feeling the need to be in control, the need for approval, the need to feel effective. These can all be things that can make it unintentionally difficult for us to have boundaries. I think I'm going to give like a personal example that activation, and this is sort of an innocuous one, but I, remember a family that I'm the middle child of 3 girls. And I had, in a previous role, I had been working with doing, family work with a family that had 3 girls in it. And I unintentionally, and I thankfully noticed this early on, is that I would, in my mind at least, be like kind of siding with the middle child in a lot of their sort of family spats. And so I was like, is this really about, what's going on in the room, or is this about your own bias because of your own role in your own family? And so it's about sort of parsing out, even internally, what is driving those kinds of choices, and is that going to show up in the room? So other barriers can be a lack of support or resources. This can lead us to feel like we have to step outside of our role. And again, that sometimes is because of our own feeling of like we need to help. But also it can be sometimes a lack of clarity or information. I'm not actually sure if this is in my role. This is also sometimes when you say a lack of support or resources, maybe I'm not getting regular supervision, or I don't have access to case consultation. And so I'd love to hear from folks. Again, folks can raise their hand and then unmute, or you can use the chat. What have you found most challenging in your practice? And you can also think about colleagues or folks that you've worked with that you found what has been some challenges to setting and maintaining healthy boundaries with clients. Fear of clients' reactions. Yeah. Right? Not wanting to have difficult conversations because of the way that the client might react. Getting clients to understand what boundaries are and how they help. Yeah, especially for those folks that we work with that have not really had models for boundaries in relationships. The client's own those clients' own struggle with boundaries. So what do what do boundaries look like for me? Well, the boundaries that look like for me is you're either everything to me or you're nothing to me. And so how do I, create a new model of, there's sometimes relationships where this person isn't going to be everything or nothing to you. Maintaining established rapport with the client. That's so important because sometimes we have to say, these are things I can and cannot do for you. And how does that not feel like a rupture or a rejection? The negative feelings that come up for me when I have to set the necessary boundary. Brianna, I feel you. It is often very hard to have these conversations. And we're about to actually get into sort of how you do that conversation. Natalie talking about setting them initially during the assessment. That's so important, right? Setting that transparency up from the beginning. Again, that only clinician in a program that has little collaboration. And then especially if other folks are maybe not, again, that sort of splitting on teams, well, why can't you answer your phone at night when so-and-so is answering their phone at night? Clients with borderline traits who have difficult with boundaries. Yeah, any client, regardless of their diagnosis, again, is that sort of all or nothing. You either can do everything for me or I don't want to see you. It can be a really, really tough thing to, and that, again, that also like trouble with emotional regulation can be really difficult. Having that sort of admin support, meeting contractual obligations, which means that you don't feel like you have control on your own boundaries. Thank you so much. These are all things that can be incredibly challenging about supporting boundary setting. And this is, again, why supervision and support is so important in terms of being able to do those things. So let's see. So, we have a lot of, we're not going to get into this too much because and mostly because CTAC has a lot of really great trainings on our website already about self-regulation and about self-care and regulatory support. And so these are some examples of things you can do both in the moment, so when you're with a client, but also on an ongoing basis to support self-regulation. But I really want to encourage everyone to go to the CTAC website, ctacny.org, to check out our other, because we could do another hour just about this. And so we want to make sure that we're, getting to this. But this idea, again, that being regulated ourselves is really important in order to be able to have healthy boundaries. And then again, we talked about sort of how, people, as we're seeing in the chat, having that sort of agency support. So for those of you who are supervisors or leaders in your agencies, thinking about, and even if you're not, how can you advocate for an agency culture and conditions that promote appropriate relationships with clients. And also someone talks about, relationships with our colleagues can also create those standards, that culture, that model of how do we do things here. That idea of like, oh, we're a work family. Okay, well, what do we mean by that? And how does that promote boundaries within our work? And then also how does that, trickle out into our work with clients? So again, building a culture that allows for vulnerability, prioritizing staff wellness, providing supervision, and then creating those opportunities like consultation for reflection processing are all incredibly important supports. So we're now going to talk about, we talked a little bit about how we construct boundaries. We're going to talk a little bit now about assessment, and then we're going to get into how do we communicate and monitor boundaries. So Nicole, I'll let you take it from here.
Awesome. All right, so starting with awareness and assessment, we collected these set of questions as it's kind of a framework of ways to evaluate your actions in a consideration of boundaries. So we have these sort of six, themes, 6 areas of impact that maintaining a boundary or a boundary extension or boundary violation can impact the work, impact the goals and the client's needs. So the first is risk. And the question is, do my actions expose me, the client, or others to possible harm either now in the moment or in the future? The next is accountability. Would I act in the same way if a supervisor or a colleague was present? Can I explain the rationale for my decision? Am I taking all the steps to appropriately document my actions? And this is going to look different depending on your setting, depending on your responsibility and your specific role. But thinking about that idea of, if someone were watching, if I had to write this down and document this in the note, would I feel comfortable with how I'm managing my boundary around this interaction? What is the intention? Intention being the next kind of area. What is my intention behind my actions? Is it possible I am being motivated more by my own feelings or needs rather than the needs of the client? Kind of what Jackie was talking about with the zones of helpfulness. Where am I falling on that continuum? Am I being driven by something that's fulfilling my desires, or is it something in serving and helping, or is it something that really moves along the client's goals and meeting their needs? Power. Do my actions create situations that would impact the power dynamic in the relationship or impair the client's autonomy? How is my awareness of the power differential that is inherent in this professional role because of the professionalization of the helper role, depending on your responsibilities? And am I making this decision in terms of the interaction with the client that's going to set them up to be autonomous in the decision and in the next step? Kind of going back to the fundamental, like we're trying to set up our clients to have these skills, be able to navigate these problems, work through these situations individually and autonomously, and not need our help for the long term. And so how do we make sure that we're respecting that power differential and putting the power in the client's hands? Awareness of role. Are my actions within the scope of treatment? Do I have the expertise needed to follow this course of action? Am I the right person for this intervention service? If someone really needs a specific type of intervention, do I have the correct experience? They're not even correct, right? Appropriate or enough experience to apply the skills effectively? Do I have the training needed? Am I the right individual? Do they need a higher level of care? Do they need a lower level of care? That could be hard too, where we see our clients succeeding and they don't need the level of care maybe that we offer. And finally, context. Do my actions best meet the needs of this particular client? Do I need to consult with a supervisor or colleague about this situation? So similar to role, but is this the right service? Is this the right intervention? Is this the right setting for this individual and what their goals and needs are? We're going to keep it moving because of time, y'all. We have so much to get through. Okay, so our next area is some strategies we want to share with you to support boundary setting. So in this way, we wanted to mention steps that just kind of ask, what are steps that you could take if you're unsure whether interactions are boundaried or if you're concerned that you're at risk of a boundary violation. We're going to actually have some questions and some other tools you can apply a little later on, but thinking about ways that you can engage in self-reflection. So going back to, the signs of a potential boundary violation, they're not black and white. They're not an if-then statement. It's more of a what's driving, what's the intention behind this boundary extension or this interaction or the intervention that I'm providing, and is it within the scope of practices, within my roles and responsibilities and the expectations I set up as the provider in this realm. You can always hopefully talk to a trusted colleague, pull in your supervisor or manager for consultation, for supervision, and refer to your agency's policies and procedures, because these are gray areas. There's very few black and white situations that are hard and fast. And so a lot of these take nuance and consideration and reflection. And sometimes you can't do that alone. We're not in this work alone, hence being here with all of you all. We need to lean on each other and ask questions and explore. All right. So we're going to practice identifying professional boundaries. So I'm going to read this case example to you all. And I think is this a click, Jackie, to make the other?
I think so. Yeah.
Okay, there we go. I didn't want to click to, yeah, perfect. Thank you.
Great.
All right. So Cesar is a case manager in an outpatient program for adolescents. He has a work cell phone that his clients are allowed to call, but he is not on call after hours. One of his clients, Jason, regularly calls him late at night when he is already in bed. Cesar feels bad because he knows Jason has no one else to reach out to for support, but is starting to feel irritated and sleep deprived due to the late night calls. So I would like you all to take a second, chat in, what is the boundary issue at hand, and what element of a boundary construction is being jeopardized. So we're thinking about the risk, accountability, intention, power, role, and or context. It may not just be one.
Right.
It may be multiple areas or issues at hand. So what comes to mind in this instance? So I see Katie says a rescue mindset. You should not be answering the call and tell the client when it's okay to call him and when it's not, from Madeline. Intention and role from Kristen. Yeah, going to the boundary construction. Intention and role, multiple areas exactly, and as taking calls after hours is exactly what's happening. Burnout resentment could manifest. Very true. A lack of limits being established. And John mentions risk. Okay, great. So what would an appropriate boundary look like between Cesar and Jason? Some of you all mentioned some strategies already. Inez mentions explore if there's a 24-hour service the clinic can provide or for on-call supervisors. Karen mentions he needs to address in a session and provide crisis numbers to call. Right. What other replacement strategies could be put in place? What other resources are available that do meet this need that Cesar is not able to meet because of his roles and because of the boundaries for his responsibilities? Karen says not answering the phone after hours. Work with the clients to address other community resources. Exactly. Lovely, y'all. On point. Okay. Communication is our next bucket, and I think that is Jackie. So hit it, Jackie.
So I just wanted to say, like, one thing I really love about what we're seeing in the chat. So the first thing that I really love is when you all talked about the issue, you talked about it's not just about not getting calls late at night. It's about not answering calls, right? I think that one thing that we've sort of alluded to, but maybe haven't said, is that boundaries are something that we create and set. It's not something that, our clients, the folks we serve, the youth, children, families, they may or may not have a good sense of what boundaries are like in a professional relationship. And that's not their responsibility to be able to do that, right? They may have not had, you know, they may have had different models of what boundaries look like in relationships, or may not have had very boundaried relationships. And so it's on us to, it's about, do we answer? It's on us to both communicate boundaries and also to abide by them. And then the other thing that I liked about it is that folks are thinking creatively. What is the need of the client? So maybe it's that the client needs more resources. Maybe it's that the client needs to hear someone's voice late at night. And so this idea that, you know, giving crisis lines, thinking creatively of how can you give the person what they need while still maintaining that boundary to do all those things that we just talked about. So I really love that. You know, I think that one, you know, person in a different training suggested, you know, could you give your client a voice note so that, you know, not during at the moment, but for in session for them to play after hours. So if they need to hear your voice, they feel like you need to be there, is that appropriate for your role? So thinking about, again, these things are going to be different based on your role, based on sort of what your relationship is and what your program is promoting with the client. I think about people who work in DBT programs versus people who work in sort of a more traditional outpatient setting. Those are different. So I think that I like this idea of people thinking creatively. Okay, so we're going to talk about communication. I'd like to hear in the chat, how do you all assert boundaries at the beginning of a professional relationship with clients? We've heard a lot of people in the chat talking about setting things up from the beginning. So what do you say to folks? How do you talk to folks about boundaries in order to define it from the outset? And I'd love to hear like actual language that you use, if you can think of it. About how you know, and you can, this can be specific boundaries that you set or just in general how you talk about boundaries. So talking about my role in their family. Great. What does my role look like? Limits, availability, work hours, mandated reporter role, right? My professional limitations, what I can do and what I cannot do. Love that. Safety and confidentiality overall, expectations, my role, hours of communication, frame the relationship as a working relationship, right? My role, what therapy is, how it's different from friendship. Yes. Rules, my role, consent forms. You thinking about time, that their visits are only 45 minutes long. A form that's amazing. Clients' rights and responsibilities. Exactly. Right. Amazing. Okay. Thank you all so much. So we have some general tips for effectively communicating boundaries. I will say that it can be really tough to talk about boundaries, you know, especially if we are working with folks that maybe haven't had, again, those sort of kind of conversations in the past. And or, you know, it may feel like a rejection to them to have someone set a boundary with them. And so how do you navigate that? You don't want your client to feel like you don't care about them. So how can you compassionately set boundaries? And this is very important, right? We can be compassionate, we can be empathetic, we can be caring and still be boundaried. And in fact, I would actually, you know, as we were saying before, argue that being boundaried helps us to maintain our ability to be compassionate and to be caring and present with clients. So as we were saying before, being proactive, so starting from the beginning, having protected time to discuss boundaries. So that, you know, maybe it's in the first session, but if your session is, as Brianna was saying, 45 minutes long, you have a lot to get through in the first session. So maybe you do it in the first session, but maybe you say, okay, we're going to talk about this in the second session, or we'll push something else to the second session. So do I actually have enough time to talk about this? We don't want to rush these conversations whenever possible. Being direct. So not dancing around to things, like being like, well, being really clear about what you mean whenever possible. And pointing out violations in the moment. So again, it is on us to protect or to maintain a boundary, and also when there's maybe a client that's pushing up against a boundary, being able to talk about that openly when it's happening, but also only initiating conversations when we're regulated. So if that stuff is bringing something up for us, maybe waiting until we're regulated to initiate those conversations. like you said, backing our boundary up with action. So if I say I'm not going to answer the phone, not answering the phone. If I say that, our sessions are going to end, doing my best to make sure that sessions end. And then again, thinking about those extensions. Sometimes, as Nicole was saying, it is appropriate. There's a crisis. You're going to have to extend it a little bit. So these are not meant to be rigid rules about boundaries, but rather things to consider when you're setting them. Practicing skills and techniques for managing our own stress response, and then again, seeking support. So in terms of how we communicate, there's a lot of different ways. One that I have found is incredibly helpful for me is the Dear Man model. And so a lot of you might be familiar with Dear Man. It's a DBT skill. So for those of you who have had any DBT training, dialectical behavioral therapy, it's one of what they call an interpersonal effectiveness skill. So for folks who maybe need help in those relationships, it's something that they can use in their relationships. I also think it's really useful for us as providers to use this, especially in a conversation around boundaries, which can sometimes be a stressful or difficult conversation. And so, yeah, Sandra, that's great. So I feel like you know that this can be really useful. My students love Dear Man. Yes. It can be great in professional settings, and also in personal settings. So, but we're going to talk specifically about how to apply Dear Man in a professional setting with respect to boundaries. So again, it's just a great model for setting up these conversations. So the first thing is to describe the facts of the situation. This is where we're going to be as objective as possible about what is happening. This is where we use I statements. We're not going to say you do that, you did this, but just saying these are the things that are happening. So, I have noticed that we are struggling to end our sessions on time. For example, last week we really barely finished, or, it seems like we always have a lot of things to talk about at the end, etc. These are really just about the sort of facts of the situation, things that you could both agree on. E is for express. So we're going to express our relevant opinions about the situations clearly. Now, for those of you who are familiar with DBT, a lot of times this is talking about our emotions and our emotional response. When it comes to doing this with a client, we don't want to put our emotional response onto the client. So this is more about things that impact the situation in terms of the relevant opinions. So you might say something like, it is hard for us, just like I want to be available to you at the beginning of the session. And that's why I, wrap up my other session on time. I want to be able to do that for all of my clients. It's important that we be able to have, I be available for that. So expressing sort of that relevant context or opinion that helps the client to understand where you're coming from. Assert your request or stance. So this is about where you're saying, like, it's important that we make an effort to, end on time. I'm wondering if I can give you a 5-minute warning before the end of our session that we're about to end so that we can make sure that we wrap up, and then maybe we make a list of what we're going to do for next time. And then reinforce your point. So this is about, again, not just why it's good for you, but also why it serves them, right? You might say, this way we're not feeling rushed at the end, that we didn't, or that you don't leave here feeling like you didn't get to talk about what you wanted to talk about. So it's not just about why this is useful for you, but also why it serves them as well. The last components, man, are a little bit about sort of just tips for the conversation. So the first one is be mindful. This is being mindful of your tone, your body language, how you're coming off to the person. This is A is appearing confident, calm, effective, competent. So that's sort of, again, staying in control. Being mindful also can be mindful of what their potential triggers are, maybe where they're going to coming from, how to sort of appropriately meet them where they are. And then N is negotiate as needed. So this does not mean negotiate the boundary itself, but be able to negotiate what, again, people talk about what you can and cannot do. So maybe I cannot extend the session. What I can do is give you a 5-minute warning. Maybe we talk about all the things we want to talk about at the beginning of the session, and then we prioritize. If you feel like you need another session this week, you can call me in advance and we can maybe schedule a 30-minute check-in if you feel like that is appropriate, right? So thinking about what are you able to do for this person and what are you not able to do, and being able to think about that creatively and appropriately with them. So we're going to do, what time is it? It's 12:15. So we are almost, I think that we're on the edge, but I do think, do we have time to do this, Nicole?
Let's try.
Let's try. Okay.
Yeah.
So we're going to be doing this activity. Use this app called Padlet in order to do a Dear Man. So we're going to be, again, talking about Jason and Cesar. So you can see there's a QR code on the page here. You can use that to access the Padlet. Also, we're going to have, Leslie is going to be putting the link in the chat. You'll see that what it's going to come up is 4 columns that say D, E, A, and R, right? So describe, express, assert, and reinforce. And what I would like us to do is to come up with some language that Cesar could use with Jason when initiating this conversation about the late night calls and in asserting his boundary. So if for those of you, if you folks could click on the link, it should take you to another page. I'm going to stop sharing my screen for just a second so that I can then show you the Padlet. But once you get in, you'll be able to see, it looks like people are already joining. So you can see the different columns, and then you just click the plus sign underneath each of those different D, E, A, and R in order to add your thoughts on what you might say as Cesar. So we're going to take, actually, I'll reshare my screen just for now so that people can see the, they can see they're
already flowing in. Nice, y'all.
Yeah, amazing. Hold on. Why can't I'm trying to, oh, here we go.
I'm seeing be very clear about the boundary that has been broken to describe. Someone write in like almost a script. I have noticed we have been having a lot of late night phone calls describing the behavior. Exactly.
Amazing.
You call me late at night when I am in bed. I see that you've been calling after hours. I see you're needing someone to talk to late at night. Okay, you're identifying the need, and then what's the intention behind it? Nice, y'all. I noticed that you were calling after hours. Explain how the late night phone calls is stepping out of the bounds, but he can call before you're done with the work for the day. Okay, saying when they are where the boundary is not violated or not crossed. Sorry, Jackie, I know you were sharing. I don't know if you want to jump in.
No, this is good because I'm trying to figure out where my screen is.
Okay, I can share it too if that's helpful.
No, I got it. I just
Okay.
Things were on the wrong.
No worries.
Here we go. Okay, so there we go. So here's the case. So it sounds like folks are
They're on it.
letting them come in. Great. And if folks are unable to access the Padlet, you can also use the chat box here to write in your response. So just we're going to give people a couple more minutes to.
I'm going to keep reading them just because of time.
Yeah,
Jackie.
go ahead.
I'm going to move over to express. So people are, someone's clearly express how the client broke the boundary. And so, yeah, someone mentioned how it shows disrespect. So I'm wondering if maybe that's a feeling that you're feeling, like it's not it's disrespectful of the boundaries that you're holding in terms of when you're available to the client. So maybe that's something you can talk about in supervision, about the feeling that's coming up, and then how to translate that to the client is that it's outside of you're available from this hour to this hour, and what other needs might there be that you're not able to meet? What else could be connected to them so they can have that need met? And someone said we have specific times to meet and talk, so reminding them when you are available. I like that you were seeking support, so I think you can benefit from a list of resources you can access after hours. After hours, again, this is not a time Cesar is available. After hours, there are other resources available. Beautiful job, y'all. I cannot answer late night calls. I'm not available. Boom, clear, to the point. All right, moving over to ask. And or assert, yeah, perfect. So has there been some changes in your sleeping pattern? Maybe there's a medical consultation necessary. Oh, so someone's even going to assess, seeing like what else is going on at night outside of these hours. So that's That's looking at other contributing factors. That's great. So request that you do not call me after hours in the event of an emergency. Call. Exactly. So this is asserting the boundary, asserting this is something I'm not available to do, but here are resources that are available instead. Clarifying the need for the late night phone calls, exploring what is driving Jason to reach out to Cesar at these hours after hours for Cesar. I love this question. Do you think we could work out a plan for how to access support after hours? Beautiful. Bringing Jason into the conversation. How can we do this together? Ask if I had this idea too. I don't know who put this in, but ask if it would be helpful to go to a community or explore community events to meet friends. Yes.
Yeah,
Jason's looking for
love that.
connection and Cesar's providing that. But again, it's not Cesar's role to fulfill that need necessarily, especially at those hours. And so how else can Jason be set up autonomously to build those connections and build those resources himself? Beautiful.
Yeah.
And then finally, reinforce. So your safety is very important to me, and I want to make sure you have the support you need while I'm
Yes.
accessible to you. Boom.
Yeah. You know, even things like when I do, if you're expecting me to answer late at night and it is an emergency and I'm not able to answer, I don't want you to think that that's, I don't want you to be reliant if it's an emergency. Or I won't be able to be present with you when I am at work because I will have been up all night. You can think about what is appropriate to share with the client in terms of reinforcement, but I love this idea of creating expectations, creating clarity. I don't want you to feel like there is nobody else out there that can help you with these things. It's important that we have clear expectations about when, and then also this is what I can do, right? So if it's important for you to, you can always leave a message and then I will get back to you within a certain amount of time. So whatever it is that you feel like is appropriate and within your role. Love this.
Thank you all
This
so
is
much. I think
great.
because of time, we should probably keep it
Yes.
moving, but this was really great to see come alive. Thank you all so much for your input.
Yes. And I'm glad the Padlet worked. This is
Yes.
a new tool for us. So thank you all for engaging in that with us. Okay, let me share my screen again. Great. So, I guess we already sort of mentioned this, but we know that it can be stressful. So really just keeping in mind that you want to seek support for having these conversations, maybe scheduling supervision before or after, and, making sure you're doing whatever you need to feel regulated during these conversations. And then, yeah, monitoring and maintenance.
Lovely. All right, so our final segment here. So we wanted to emphasize the fact that boundary construction and identification assessment is not a one and done experience. It is an ongoing. It needs to be constantly considered and monitored and maintained. So this section is about how does assessment translate into ongoing maintenance of boundaries. So wanting to emphasize that consistency is key. It's really difficult to maintain boundaries after a boundary has been previously crossed. I think naming extensions as needed, such as, crises that come up, we had to extend because we were managing this situation and we got you the help that you needed, but that we're going to go back to our 45-minute sessions when you are safe and there's not a crisis at hand. So addressing them and then, monitoring them and seeing how they're continuing to show up in the work with the clients. If there's a different kind of boundary violation or crossing, there's a potential that the client can react negatively or intensify boundary crossing kind of testing behavior in order to restore the previous status quo. So perhaps there was a time, I've seen this in many spaces I've worked where there's an exception made, I'm gonna, you ran out of we didn't talk about lending money or clients asking for money, but a clinician lending someone $10 so they could buy lunch. Then that sets a standard of that's the boundary that you're going to maintain. And if you then have to say, I did it once, but I can't do it again. The client, why do it once if you can't keep doing it? And so how do you help the client meet that need in the moment without compromising what your boundary is? And then major boundary violations are often preceded by minor boundary extensions. So it's really important. Again, this is not black and white. This is not an if then. It's just an emphasis to continue to monitor and to continue to assess and reflect. Why are the extensions happening? Are you openly talking about them with your team, with your supervisor? Do they abide by your agency's policies and procedures? And we already did this exercise, so I'll run through this quickly, but it's helpful to set the tone from the beginning. When am I available? What will our time together look like? What can I help you work on? What do you want to work on that is within my role? What can't I do that you do want to work on? How do I get you connected to that sort of support? Okay. Long-term strategies, emphasizing that self-awareness, knowing where you start and stop, what you need in this work, and how that bridges over to the next one about self-care, that your emotional needs are being met outside of your interactions. If you are getting your needs met from the work, how does that impact the work? What's the intention behind that? And how are you openly processing that in supervision with your team? And reflecting on the meaning of the work to you. What brought you to this work? What makes you feel satisfied? What is dissatisfying? What do you not like about it? Because there's parts of that for all of us. And what might make these things affect how you approach your work with clients. For me, notes were the bane of my existence when I was in a community-based clinic. And so more sessions meant more notes, and so how does that affect how I was approaching the work and approaching sessions, and being aware and processing that with my team and my supervisor. And so what does one do if a boundary violation occurs? We didn't want to ignore this. Boundary violations happen. That's why we have to talk about it. And again, have to emphasize that this is not a one and done black and white answer. So these are not best practice. These are best practices and what you should do to find out what is the best course of action for you. So you want to always consult with your agency's policies and procedures. You want to consult with your supervisor and bring it to them for their input and for their awareness. You want to potentially, depending on the kind of violation, address it with the client, and that would be with your supervisor's support and input and following your agency's policies. And these are going to be case by case, depending on your setting, depending on the violation, depending on so many variables. So again, not black and white, but we wanted to address the fact that you all are probably asking, well, what do you do if it happens? And we want to talk about how to avoid it, but here are some suggestions for what to do if they do happen. And lastly, with 2 minutes, a final tool that we wanted to provide you all. This set of questions comes from a self-assessment called the ProCool. It's going to be linked in the references slide. And it essentially is a list of questions that you can ask yourself. And the scale is, it's rarely, or it's never, rarely, sometimes, often, or very often. So thinking about what is your answer to each of these questions from a never to a very often or always sort of spectrum. And depending on your answer, taking a moment to, reflect on that. What does that mean? If I'm preoccupied with the person that I help very often, what does that mean about the boundaries that I'm maintaining and my self-care and how I'm able to sustain for all of my clients that I'm serving in this work? So because of time, I'm gonna stop there. But take these resources. Thank you all so much for your input and for your participation throughout this presentation.
Yeah. And I know that some folks are asking about suggestions for policies and boundaries. You can look at the resources here. And I feel like there's suggestions in each of them for sort of a standard. But I also think that, again, thinking about sort of the reasons why, and it's going to look different based on different agencies, different roles, different programs, what boundaries look like in an inpatient program versus an outpatient versus a school-based, is going to be different. And then, are you a peer? Are you a clinician? And so I think that thinking about that as well when, creating those policies and procedures. I think that we got to most of the questions throughout but thank you all so much. Again, please take the survey at the end here to give us your feedback. We do actually really read each and every one of those surveys. And so any sort of thoughts about what you'd like to know more about, it could be relationship to this or just in general. And yes, thank you all so much. And I hope that you all have a great day.
Bye, everyone. Thank you.
Thanks, everyone.